Thank you very much, Claire. Good morning, colleagues. I'm delighted to welcome you to Perth for your conference. I'd like to say welcome to sunny Perth, but I'm not sure there's many parts of the country that are sunny today, but you're welcome nevertheless. And I want to thank Mike and Lisa for their initiative in organising this conference and having the idea, because I actually think that this is the right time to be having this discussion, and I'm going to say in a few moments why that is. So I'm sorry I can't be with you today. Monday is a day when I spend most of my day with our politicians, with our various leaders within the council. I need to get back for those meetings, but I'm pretty sure that you will have a very informative and enjoyable day. Colleagues, I said that I thought this was the right time to be having this conference, and I think there is absolutely no doubt that we live in interesting times. The global challenges that we face are pretty significant, and I'm not just talking about the rapid change in technology and technological developments that I don't know about you, but I struggle to keep up with. I'm there with Facebook and Twitter, I think, but then Instagram's come along and I haven't a clue. And it's how your young relatives keep in contact with you. So I'm learning, but not very well. But there's no doubt that we live in a complex and globally interconnected world. And I think the challenge for us is we need systems which will help us manage public services in a way that's relevant to our current environment, not necessarily repeating the practice that we've had in the past. Because this complex, confusing, and radically interconnected world means our role is more complex and more challenging. And I think the other challenge for us is the emergent future. We just don't know what's ahead of us. I've recently been in discussions with colleagues about the financial challenges we face are probably the greatest in a generation, but also the scale of the reform across public services is the biggest change since the creation of the welfare state. And all of this is happening at the same time. And I think all of that is relevant excuse me, to the conversation and discussion you're going to have today. If you think about not just technology, but think about the last 12, 13, 14 months and how much rapid change there has been. We had the referendum, we have a new programme for government, a new First Minister with a personal and First Minister commitment to inequalities and tackling inequalities. And that's very much evident in the theme across the programme for government. And we've had the UK general election and shift in the political landscape of Scotland in terms of the Scotland Act and the Scotland Bill, which will finalise its parliamentary progress today. And we've had the Community Empowerment Act and all the other various pieces of legislation here in Scotland. And so what is clear is that the context today for our discussion is that the world around us is changing in many, many ways, and we need to respond to that. We also need to respond to the fact that people's expectations of public services is changing, and our ability to actually respond to those changes is more and more limited. So we need to do things differently, and I think there's a huge contribution you have to make to that debate and discussion about the future shape of public services here in Scotland. The big agenda is very much about learning, it's about welfare and employment, but it's about very much using the powers that we have in local government and in public services to tackle the big challenges of our country whilst addressing rising demand for services. So information and data is absolutely key. And I wanted to give you a couple of examples of what we're doing here in Perth and Kinross, just to illustrate those points. But before I do, I'm the chair of the Local Government Benchmarking Framework in Scotland, and many of you may have heard of that. And what we've been trying to do is to gather information to allow us on a comparative basis to address issues around cost and performance. And certainly we've had a lot of interest from the Accounts Commission and Audit Scotland as far as that's concerned. There is also another group looking, I think it's called the Outcome and Evidence Data Group, and that's looking at how we can develop common indicators across community planning partners, again to inform our agenda going forward about where decisions need to be made, about how services could be organised and delivered differently. And I think part of the difficulty going forward for me is that we're drowning in data, we're drowning in information, and it's how we manage that effectively going forward. But let me give you a couple of examples from Perth and Kinross in terms of what we're doing. Because I think we recognise that we need to do more in terms of the information, the data, the evidence that we use to inform our strategic and operational thinking and how we deliver services. And we've recognised that in the current climate of financial austerity, that information and data will be absolutely key to informing some of the hard decisions that we need to make, and particularly where some of the transformation projects may be significantly high risk. So we're very much improving our practice, and we recognise we needed to invest in information and data in a different way, because we need to move to a much more evidence-based approach to informing our decision-making and our practice. And I want to give you two examples. The first is called Evidence to Success, and colleagues from Perth and Kinross Council in the room will know about that. And basically, we have so much data, so much information about children and young people in Perth and Kinross. What we wanted to do was to hear from parents and children themselves. So through a data gathering exercise, we now have data on 94% of the children between the earliest months and weeks of life to the age of 16 on 10 developmental outcomes. And that's been the most powerful and informative piece of work that I think many of us have been involved in, because we're hearing from children and parents about what matters to them, and we've used that information to reshape our priorities about what matters. So, for example, that information was telling us that 25% of children, or 25% of parents, didn't feel their children were school ready at the start of primary one. We had information about breastfeeding. We had information about how engaged children are in the later years of primary school. We had information about substance misuse, etc., etc. And we've used that information, we've used that data to reprioritise and to shift our spend. And that's been a pretty significant journey for both elected members and senior officers. And it's something we intend to do more of, because we're using that to ensure that we're investing in the right areas to reduce future demand on services. And the conclusion from that work are that we now have a better understanding of need and a better understanding of how we respond to that need by investing in evidence-based programmes which are tried and tested. So there's been a lot of learning for the organisation from that, and we need to do more in respect of that. Another example I want to give you, and many of you may know about this already, but if you don't, I think, again, these are the kind of projects, and this is the kind of change that we need to be making in our ways of working in order to ensure that we have effective and sustainable public services going forward. And it's the integrated resource framework. And I don't know what knowledge people have in the room, but we have developed over the years very, very, very sophisticated use of information in health and social care terms. So, for example, one of the indicators is the number of people who are over age 65 living at home at any one point, and the target's 98%. And we have locality variation, which is hugely significant. So in Perth City North, they have the highest percentage of people living in care homes but the lowest percentage of people living at home, which is quite different from South Perthshire, which is a more rural area. And so, using that information, we're able to drill down and ask the questions, why would that be? Is that about clinical behaviour and practice? Partly. Is it about need and poverty and deprivation? Partly. Some of it's also about proximity to an acute hospital. But the point is, when you look at the consumption of spend, the spend on services, the consumption of health and social care information, and you look at why one practice has a high level of acute admissions which we cannot afford going forward and with a growing elderly population, we start to ask the questions why. And that is why information and data is so powerful, because it allows us to examine how effective our practice is at the moment and to look at ways of changing that. And I think that's the challenge going forward. We need the right information at the right time, and we need quality, robust information if we are to address what are the very significant challenges I talked about in terms of those generational challenges around finance and rising demand for our services. And for those reasons, I think your conference is coming at the right time to allow all of us to think our way through how we meet these challenges and what is the role of information and data to help us to continue to secure the best possible outcomes for people across our country. Thank you very much and good luck.